Hey, everybody. Good evening. It's Dr. Kadisha, your board certified emergency medicine physician, author of the best selling book, Help Us Help You in the Emergency Room, and creator of the Mini Mobile MD Kit. It's the kit made expressly for this time for personal protection during these times. And I'm here today because I want to discuss COVID 19 and workplace safety. I've finished a number of shifts and treated a number of people who are working on site and who unfortunately had come down with COVID while at work. So I really wanted to discuss this topic with you. Just things that employers and employees should know so that they can be most safe while working on site. Of course, I have to work on site. A number of essential workers must work on site, and I definitely appreciate all that you do, and I want to help keep you safe and out of the ER. So, who is the expert? Who are the experts on workplace safety? Who are those people to whom we should refer? Well, that would be the CDC and OSHA. OSHA being the Occupational Safety and Hazard Association. They are the ones that help create regulations and practices to keep us all safe on the job and help to make sure that our employers keep us safe. So I'll give it a couple of minutes to come into the room. We won't just jump right into it. And because I'm referring to OSHA and the CDC, I will have some notes. So, pardon the noise of, any papers rustling, but I do want to share correct information with you. So while I'm not your physician and this doesn't constitute medical advice or a patient-physician relationship, I definitely want you to have this information or at least be aware of questions to ask your employer when you're working on the job. So we'll just give folks a couple of minutes to come in. Whoever is present, definitely let me know in the comments. I'd love to give you a shout out, and we'll just see who comes into the room. I hope everyone's having a great week. I know that there are a number of, new developments, and I'll just say, while this is unrelated, it is important that it is being recommended that we wear 2 masks instead of 1. I've always been wearing 2 masks, usually a surgical mask and a cloth mask on top, just for extra protection. So that's one thing. That there's been a vaccine shortage and, a number of appointments for people to get vaccinated were canceled amidst the confusion about how many doses of vaccine were available. But President Biden has purchased another 200 million doses of vaccine, which 200 million doses of vaccine, which is definitely a comfort. I'll definitely do a discussion about my vaccine experience. I'm actually in between my first and second dose, and I'll be getting my second dose next week. Okay, so now that it's been about 4 minutes, we'll get right into it. So, employers' COVID-19 preparedness, response, and control plans should take into account a number of factors. And so I want you to, maybe have a pen and paper ready just to take some notes so that you can have these in mind when you go to work tomorrow, employees. And, maybe there are some employers who might not have thought about certain of these things to take into consideration. But Consider the feasibility of social distancing in the workplace. How feasible is it to have workers remain at least 6 feet apart, throughout the workday? If that's not feasible, is there the ability to stagger shifts so that fewer people are in the workplace at any one time? It's a great idea. And how about the degree to which employees interact with the public in person? These are things that employers need to consider when taking on preparedness for COVID-19. Another thing are the employees themselves. Are there employees who live in kind of cramped conditions? What is the proportion of employees who are at risk for severe illness? And are there policies regarding sick leave for the staff? Are there sick leave policies for the staff in place, and are the staff aware of such policies? And last but not least is the priority for the continuity of operations. So these are 8 things that employers have to consider when putting together their preparedness and response and control plans regarding COVID-19 or, many conditions. And all of these things must be considered within the context of the level of COVID-19 disease transmission in the community. And to that end, businesses and employers are encouraged to coordinate with state and local health authorities in order to obtain timely and accurate information to help guide their response. Okay, so yes, state and local health officials should be taken into consideration when developing a preparedness, response, and control plan for COVID-19. The state and local health officials, as well as the level of disease in the communities. So, say local and state health officials, or say, there's a national policy regarding interruption of various businesses. Resuming normal or phased activities does provide an opportunity for the employer or business to update their preparedness, response, and control plan to COVID-19. All employers should implement and update as necessary a plan that takes into consideration your specific workplace, that identifies all areas and job tasks with potential COVID-19 exposures, and that includes control measures to eliminate or reduce such exposures. So when coming up with that plan, in conjunction with advice from the health officials, be it national, state, or local, have in mind a plan that is specific to your workplace, that identifies all areas or tasks or job positions that are potential COVID-19 exposures, and consider also control measures to eliminate or reduce such exposures. So just to get a handle on these things ahead of time, this is a good way to mentally approach developing such a plan. Okay. So in this way, we have our workplace ready. Employers have their employees ready, so that no one has to get ready should someone come down with COVID-19 while at work. Because Like I said, I had a patient who I had to tell that he had COVID-19 after a couple coworkers came to work and didn't alert anyone, or they didn't alert anyone. Of course they're not going to alert anyone because they wanted to continue working, but so they didn't tell anyone that they had COVID-19. And unfortunately, a lot of people will still come to work with COVID-19 because a lot of times people have very mild symptoms. I saw plenty of fever, coughs, and sore throats this weekend that ended up being COVID. And these people are walking, talking. You wouldn't even, know or suspect that they had it. And these could be your very coworkers. So how can we keep our workplaces safe, or at least safer, regarding COVID-19 or any of these viral illnesses? Because, it's still cold and flu season. All of the other viruses that typically get us ill haven't gone away. It's just that now we are, adding COVID-19 to the mix. Okay, so anyone who comes in, definitely let me know you're here. Say something in the chat, say hello, let me know, express any questions or concerns. Hey, Dr. Dietrich, thank you so much for coming on. I hope all is well with you and your family. Thank you so much. I really appreciate you checking in. So what are some things that employers, businesses can do to help keep us safe during this pandemic for those of us who still have to come in to work on site? Of course, we'll start with the basics. Promote frequent and thorough hand washing, including providing workers, customers, and worksite visitors with a place to wash their hands, a convenient place to wash their hands. If soap and running water aren't immediately available, provide alcohol-based hand rubs that have at least 60% alcohol. Okay, a lot of places do have sanitizer right at the doorway. I'm very happy to see such things. As soon as folks come in, have them sanitize their hands if soap and water are not available. Now, another thing that I don't like, and it's a pet peeve of mine, is seeing sanitizer right next to soap and water. Why is sanitizer there on a sink? If soap is there and water is running, wash your hands with soap and water, especially in bathrooms. I don't understand why sanitizer is right there on the sink. Don't understand it. Soap and water comes first. Thank you to all who's coming in. Definitely say something in the comments. I'd love to see and hear from you. Another thing is encourage workers to stay home if they are sick. Again, encourage workers to stay home if they are sick. The poor patient that I had who was infected by his coworkers who came in sick and didn't tell anybody, his whole family is going to be affected now. He was on the phone with his wife and he had to tell his wife, to get ready to accept her COVID positive husband home. Hey, Victoria, thank you so much for coming in. I hope you get something out of this information. I'm providing information to employees and employers and businesses on how to make their workplace safe during COVID-19. And again, for this information and more, definitely check out the CDC website and the OSHA websites. Okay, so encourage workers to stay home if they are sick so that they do not contribute to additional COVID outbreaks on the job. Another thing, number 3, encourage respiratory etiquette, including covering coughs and sneezes. Luckily, one very important function of masks is that they cover coughs and sneezes. But you just never know. You can't hear that enough. Another thing is to provide employees, customers, and the public with tissue and convenient trash receptacles, because someone might have to remove their mask to blow their nose or, if they're coughing, people do, I've seen them spontaneously remove their mask to cough or sneeze or something like that. And they need to have tissues nearby to quickly contain that eruption, or whatever you want to call it, and to conveniently contain them and to conveniently dispose of those respiratory droplets or what have you. Okay. Another thing that employers can do is explore whether they can establish policies and practices such as flexible work sites, such as telecommuting, flexible work hours, again, staggered shifts to increase the physical distance between and among employees and others if state and local health authorities recommend the use of social distancing strategies. Honestly, as a physician, as someone who has seen more than my share of COVID patients, I would advise, maybe being proactive and maybe not waiting until, various outbreaks occur to prompt these health authorities to make such recommendations. Why not get ahead of the curve in preventing infection by staggering shifts if that's is at all possible? Another thing, discourage workers from using other workers' phones, desks, offices, or other work tools or equipment when possible. Of course, if someone's out of the office, another person might be tempted to take that office if they're in a cubicle or something like that. They want that window view and everything, but sometimes it might not be worth it in order to maintain your health. Just stay where you are. Unfortunately, you're going to, that office will have to stay empty, but there might be a very good reason why that person is not at work today. Okay, so no sharing of phones, desks, offices, or other work tools, pens. Try to have your own pens also, and maybe even sanitize the pens during the day. I've seen a number of workplaces that have a cup for sanitized pens and they have a cup for used pens. It's a very an excellent practice. Another consideration, this is probably my seventh consideration under having your employers and employees ready, is to maintain regular housekeeping practices. Unfortunately, it might be more money, but the safety is worth it. The prevention of COVID-19 is worth it. To have regular housekeeping practices, meaning having housekeeping come maybe a little bit more frequently for routine cleaning and disinfecting of surfaces. There is a difference between sanitizing, cleaning, and disinfection of surfaces, such as equipment and other elements of the work environment. When choosing cleaning chemicals, employers should consult information on the Environmental Protection Agency approved cleansers that that have effectiveness or efficacy against emerging viral pathogens. Products with EPA approved that are EPA approved as far as efficacy are expected to be effective against SARS-CoV-2 based on data for harder to kill viruses. And also, I know we like to spray and wipe. Actually, we need to start actually looking at the actual labels of our cleansers and see, do we have to leave the cleanser in place on the surface, for at least 30 seconds to make it effective? We need to now pay more attention to the way in which these cleansers work for the best elimination of viruses. Hi, Chandra. Okay. Hi, Chandra Chester. Okay. Thank you so much for coming in, trying to connect with you. Please inbox me. Okay, sure. Will do. Thank you. Also, another thing is developing policies and procedures for identification and isolation of sick people if that is appropriate. I know things could probably get a little touchy. People could be afraid to even cough or sneeze in the workplace. But if someone, and that may or may not be of any significance, unfortunately, allergy season, people have allergies all year round, especially down here in Texas where it's currently 70 degrees. It feels like springtime, summertime here. So, that sneeze or that little cough, it could be allergies. Try not to be too alarmed. But if someone really is coming down with an illness, if they feel feverish, if you see someone sweating, or, if there's frequent coughing or something like that, a person complains of chest pain, shortness of breath, your workplace should have a room or an isolated area where someone who becomes acutely ill can reside until they're able to leave work and, go home or get medical care at a facility. You don't want to be in a situation where someone, admits to being ill, looks acutely ill, but they cannot properly isolate themselves from the others who are healthy. You want to have a place where you can isolate yourself should you become ill. Okay, so what's the next topic? So employers should definitely inform and encourage their employees to self-monitor. To that end, monitor yourself. You don't want to be the one who is known or suspected to have caused a COVID-19 outbreak at your workplace. So monitor yourself, monitor your symptoms. Like for a fever, cough, sore throat, I saw plenty of that in the people for whom I got positive COVID-19 test results. Fever, cough, sore throat, those were the main things. I think there was maybe some headaches that came later in the course, but it seemed like the theme was fever, cough, and sore throat. Now, you're probably wondering, how can you monitor such symptoms so well? Well, especially a fever, maybe, if it's possible at all, carry your own thermometer. The digital thermometers are great, but if you don't have that, sometimes the thermometers do become scarce. I know this time last year, thermometers were extremely scarce, but you can have something like the Mini Mobile MD kit. It has thermometer strips in it. These are reusable, and this can be your own personal strips. And the kit has gloves, thermometer strips, sanitizer, and masks that you can wear under the mask of your choice. But yeah, I think everybody in a workplace should have something like this so that they can keep all of their essentials in one convenient place. Maybe have one for your desk, one for your car, so that you can make sure that you're safe everywhere you go. I know I hate going to the gas stations and, sometimes you feel like wearing gloves. I know they say it's crazy. You worry about cross-contamination, but if you use the gloves for one specific task and you dispose of them properly, then it is protective. So Dr. Dietrich is asking where she can get one. Thank you. So here is where you can pick up the Mini Mobile MD kit, your own personal protection for cold, flu, and other virus season, and even other products like my book or the Mobile MD kit. Thank you for asking, Dr. Dietrich. I really appreciate that. So get them for your coworkers. See if your boss can order them in bulk, so that everyone can be protected. Because when everyone is protected, then then the protection is adequate. It's no good if one person is protected and everyone else is not. Everyone's still vulnerable. So back to where we were. So we were saying, monitor your own symptoms, look out for your coworkers, and if someone does become acutely ill, have an area ahead of time that people know to go to isolate themselves, so they don't get so they don't cause a COVID-19 outbreak. Okay, so when appropriate, like we're saying, employers should develop a place to have folks go should they become show signs of infection. Although most work sites don't have specific isolation rooms, designated areas with closable doors might serve as an isolation room until potentially sick people can make it home. Okay, so take steps to limit the spread of these respiratory secretions. Again, provide face masks. Again, thank God they're not as scarce as they were this time last year. If you can't get the mini mobile MD kit, there are masks in drugstores and grocery stores, at least just the surgical masks that you can get. But, if you want to make sure that you have everything that you need, check out the mini mobile MD kit. Okay, but I got more information for you, not just talking about the kit. Okay, so in addition to having plenty of masks and other forms of protection like sanitizer and forms of ways to monitor your symptoms, such as the forehead thermometer strips, ensure, what happens if someone is sick, and because we need to make people feel more comfortable about staying home when they are ill. We keep saying, stay home if you're sick, stay home if you're sick, but a lot of people are still going to work with COVID, and they're spreading it to their coworkers who might be at increased risk of severe illness. They're still doing that so that they can make money. So hell, celebrities are still performing in clubs just to make money. Here in Houston, we had a number of celebrities who were called out for drawing large crowds, hundreds of people in one space, filling clubs to capacity, causing hundreds of people to mill around outside because they still feel the need to get money. And these are celebrities doing this. So if celebrities are doing it, of course, white collar and blue collar folks, we're still going to work sick. It's like ER doctors, it's almost like we're not allowed in many places to get sick. If an ER doctor feels sick, they'll tell you, come on in, we'll treat you. And I've spent a couple of shifts working with an IV in my arm. So, but we can't have that right now. If folks are sick, they should be allowed to stay home. So employers, ensure that sick leave policies are flexible and consistent with public health guidance, and that your employees are aware of these policies. Talk with companies. Another thing is talk with companies that provide your business with contract or temporary employees. Talk with them about the importance of sick employees staying home, and encourage those businesses, to develop non-punitive leave policies. In order for us to stop the spread of this virus, people need to isolate themselves if they become ill, or quarantine themselves until they know whether or not they have COVID-19. So you see, there's a difference between quarantine in isolation. Quarantine is used for anyone who is a contact of someone infected with COVID-19, whether the person has symptoms or not. Quarantine means you remain separated from others because you have been exposed to the virus and you may be infected. For COVID-19, that means staying at home for 14 days. So employers, businesses, you may have to put a policy in place that is forgiving, that is flexible, to allow someone to stay home for 14 days if they were exposed to someone infected with COVID-19, especially if they're on your site. If they're on your watch, you should be forgiving and let these people stay home for a couple of weeks. Another thing, and this is from OSHA, I'm not making this up. Do not require a healthcare provider's note for employees who are sick with acute respiratory illness to validate their illness or return to work. As healthcare provider offices and medical facilities may be extremely busy and not able to provide such documentation in a timely way. I had a patient brought in by their aunt who wanted me on Friday to fill out a return to school note for Monday. Not only is that not advised by OSHA, but anything could change between Friday and Monday. Kids do a lot on the weekends. His status on Friday could have definitely changed by Monday. It made no sense for me to try to do a return to school note on Friday for a Monday. Okay, and OSHA agrees. I was actually surprised to see that. Another thing is to maintain flexible policies, again, that permit employees to stay home, but also to care for a sick family member, to care for a sick family member, because, hey, if that family member has COVID-19 and if they share a household with your employee might actually be contributing to an outbreak at your workplace if they're not allowed to stay home with their sick family member anyway. So try to have flexible policies that allow that to happen, that allow your employee to stay home with a sick family member. More employees may need to stay at home to care for sick children or other sick family members than is usual. That's just something that has to happen at this time. Because please recognize that workers with ill family members may have to actually do that. Lastly, be aware of your employees' concerns about pay, leave, safety, health, and other issues that might arise during these infectious, seasons for these infectious diseases. And because, again, that worry about pay and leave and all might cause some people to throw safety by the wayside in order to keep that money coming in. Maybe ask your employees how they feel about that, what their understanding is of the sick leave policies regarding this pandemic, and fill in any blanks, eliminate any blind spots. Okay, so just wanted to give out that information. I hope this definitely makes you aware of things that you may need to ask. At the very least, makes you aware of questions that you need to ask your employer about ways that they are or are not helping to keep your workplace safe, and what protections you have, and what the policies are regarding leave to stay home if sick personally, or if there's a need to care for a sick family member, just to put people at ease and make them more comfortable with staying home should they become infected. We do not need people to continue to come to work infected and infect others who could eventually affect someone who might have a severe illness and who could possibly have a very bad outcome from COVID-19. Much appreciation to all of those people who have to work on site. Those people working at grocery stores, those people who are handling sanitation, maintenance people, and more. We thank you, but we also want you all to be safe. I know I want to stay safe. And just ask your employer, what about these things? And what are my options? What recourse do I have should I become sick? Okay, so definitely, you can put some questions in the comments, but again, for this information. So Victoria asked, regarding the vaccine, how many days in between can you stretch the 2 doses due to the shortage? I'm not quite sure, because I know that they're trying to increase the number of people who can get the first dose, but I can definitely look that up for you and maybe put that in the comments so everyone can see the answer to that. But I knew that they were proposing that, but I hadn't heard the actual number of days between the 2 doses that they were willing to extend it to due to the shortage. So I'll put that answer in the comments. And if anyone else has any other questions, do put them in the comments, and we'll continue this discussion there. Again, I'm Dr. Kadisha. I'm your board certified emergency medicine physician, best-selling author of the book Help Us Help You in the Emergency Room, and creator of the Mini Mobile MD Kit. It's our way to make sure that we have everything that we need for the pandemic or for just cold and flu season in general, with surgical masks, sanitizer, gloves if you need them, and forehead thermometer strips should you feel a fever coming on. So, just so that you actually know whether or not you have a fever. And I also have some extra things in here, like for wound care, some Band-Aids, antibiotic ointment, alcohol, things like that. All of those things are in this tiny little kit that everyone should have, just so that they make sure that they're completely covered in that sense. So definitely follow me on my Instagram page at dr_Kadisha_MD. You can definitely follow me there, and here on my Facebook page. And also, if you want to get the kit, the book, or any of those other items, check out my sales page here. And then for other information, you can go to my website, drkadishamd.com. Thank you so much for your time. I hope this helps you, and I'll see you in the next video. Bye.